Welcome to News Can Use. I'm your host, Devin Banfield, in for BG. This is the second part of a series about discrimination in healthcare. You saw BG speak with Amy about racial discrimination in medicine, and today I'm talking to Maia about discrimination that women face while trying to see a doctor. Maia Leggott is a Toronto-based writer and advocate for endometriosis awareness and was diagnosed with the disease 10 years after being brushed off by doctors as just having bad periods. Now, before we get into all of that, I need you to do a few things like subscribing to this channel, tapping that notification bell, and making sure to follow us across all of our social media. Those details are in the description down there. Endometriosis is a debilitating chronic pain disease that affects 1 in 10 women and an unknown number of trans and non-binary people. The disease causes tissue similar to the tissue that normally lines the uterus to grow outside of your uterus, causing pain, irregular bleeding, and other complicated symptoms. Maia Leggott was first diagnosed 10 years after she first started experiencing symptoms and says she feels that doctors were more concerned about trying to preserve her fertility than actually improving her quality of life. Now, for full transparency, I also live with endometriosis, and today Maia and I sat down and had a conversation about the barriers that women from all backgrounds face while trying to find a doctor to take them seriously. Maia, thank you so much for joining us on News Can Use.
Thank you so much for having me. I'm so nervous.
Don't be nervous. So you are an advocate for change in healthcare. You talk a lot about discrimination in healthcare, about women's suffrage in healthcare, and how the healthcare system just isn't built for women, right?
We're absolutely
50% of the population, and we have no funding and no research and very limited facilities to take care of women's biological needs.
Yeah.
So you have endometriosis,
right?
I
have endometriosis. I was diagnosed 12 years ago, and I had been going to doctors since I was 12 with issues, excruciating pain and bleeding. And when I was 15, their solution was put me on the pill, come back and talk about it when you're ready to get pregnant.
So no diagnosis, just
no diagnosis.
You're having these bad periods, let's put you on the pill.
Yeah, exactly. And like I had cysts on my ovaries, and they were like, oh, this will fix you until you're ready to get pregnant. And it was like, I was 15, I didn't know anything. Like, yeah, sure, I knew I liked guys, but I also knew that I liked women, but that wasn't something that you talked about, especially with healthcare providers. And the assumption to just like blanket put a child on birth control and say, you can stay on this until you have a baby is just so heteronormative and so like ignorant.
So they're mainly like focusing on your reproductive health as opposed to like the pain you're experiencing and the bleeding you're experiencing.
Exactly. Like there's not a lot of conversation happening about what patients want. Like reproductive health is so focused just on that and not on like the whole person, like an issue like endometriosis. It's a whole body disease. I recently got consented to have a hysterectomy.
Okay, and that's big. That's big
huge.
Because you're very young to have a hysterectomy, right?
I know it's not a cure for endo, so I was very much advocating for the best care that I could possibly get. And that meant to me, a hysterectomy will take this out of my body.
What was your doctor's reaction to that?
My first doctor was like, no, that's not an option. My first endosurgeon told me after my excision surgery that I could try to get pregnant to ease my symptoms. She didn't ask if I was in a relationship. She didn't ask if I wanted kids. She didn't ask any of those things. Just said, some people find getting pregnant helps endo. And like that's such a damaging thing to say, not only to people who are like experiencing infertility and like going through reproductive health issues, but I didn't feel safe being out for a long time as a queer person. And so assumptions were made that of course you want to get pregnant and you're with a man because that's just how medicine thinks of women and femme-presenting people. Like the central narrative is that storyline of infertility, and it discounts so many people who have different experiences.
What would you say to doctors who value their patients' fertility over their quality of life?
I would say you need to seriously rethink your approach, because while that may be the case for many people, I think for most it's not. And when you lump in, things like like chronic pain and things in with fertility, in with identity, you don't see the person. Like, this is a whole person with a life who's affected by this and who can't get care that they need.
What does living with endometriosis look like for you?
I haven't been able to work, lost relationships, you lose friendships, you're missing out on things all the time. I've seen so many different doctors and people, and I almost feel like there's an expectation of suffering, like it's just kind of...
Like you have to be suffering a certain amount to be taken seriously?
Yeah, exactly. And it's...
Dehumanizing?
Thank you, it's dehumanizing, and it's...
Because for full transparency, I live with endometriosis and adenomyosis as well, and Maya and I met through advocating and doing advocacy work and writing together about this.
Yeah.
And I feel like living with this disease can be so dehumanizing.
It
when
is.
You're only thought of as a uterus, when you're only thought of as a malfunctioning reproductive system, when you're only thought as a person with women's problems.
Yeah. Endometriosis is not just a women's disease.
Because endometriosis affects 1 in 10 women and an unknown number of non-binary and trans people, right?
Because the research just isn't there. It doesn't exist, and there's a huge gap in that.
Right?
Yeah. And so that makes it even harder for people who don't fit this, certain stereotype with fulfillments.
How would you like to see the medical system change to better help people living with this disease, specifically living with endometriosis, adenomyosis? How could doctors do better? How could the medical system do better?
We need to listen to people, and also there's no money in it. Like, endometriosis costs the Canadian government $1.8 billion a year, like mostly in lost work revenue
and medical costs,
exactly,
and all kinds of things.
And so when you think about the fact that a general practitioner, like the average general practitioner, may not be able to diagnose that, that's a problem.
When you have to see 5 to 7 plus doctors to get a diagnosis, that's a problem.
It's a problem. And when you add being queer or being trans or not caring about your fertility to that,
it's a further barrier.
It's a further barrier. Research needs to be done, voices need to be heard, and we need a plan in place,
to improve this care.
Exactly. Advocacy can get you so far, but materializing it into some kind of tangible action is what needs to happen. And people need to realize that women and others assigned female at birth are struggling. And need support and
deserve quality
care. And it doesn't exist. I mean, it does exist, I shouldn't say that.
But it doesn't exist at the level that it should for the amount of people that it affects.
Exactly.
Well, thank you so much for joining us on News Can Use, and I hope next time we see you, it's with better news and more change.
Thank you.
Hey BG Squad, thanks so much for checking out our channel, and listen to this, we have more great content for you, like this video right here and this video right here. By the way, don't forget to subscribe to this channel right now and tap that notification bell.